So I mentioned last week that I'm 2 years into ruling in or ruling out cancer. And I was kind of expecting someone to say, how the hell does that happen? Or maybe you guys all know how it is in medicine. I don't know. I'm a little surprised that it's like this fucked up. Um, and I think it's a valid question. Like, how does that happen? So I thought I would just kind of clarify, why am I 2 years in to trying to figure out if I have cancer or not? What has happened is my doctors were ignoring me and refusing to do any workup. And then when the symptoms got obvious and they had to order some imaging, they did. And then they did the follow up. And then they just started ignoring me because they don't understand like the check two. They don't understand, that I am essentially like a tumor syndrome, but I don't have an established tumor syndrome. I kind of have like my own kind of tumor syndrome. So my risk is very different. The treatment guidelines don't really cover my situation. So they just got tired, I guess, of me. So I had to switch specialists because I'm not taking no for an answer. I want a thorough and complete workup. When you grow this many tumors, I have learned that you always have to do everything to figure out whether or not you need surgery, whether or not you need some kind of intervention. And so far, for the most part, my tumors all require monitoring, and I do end up having surgery for different tumors. I've had 3 different tumor mediated or tumor caused surgeries. So it does happen. So I'm not like totally like nuts over here. Like, I get tumors, I have to have surgery for tumors. I'm on all sorts of thresholds or meeting all sorts of criteria for follow-up imaging. So I do a lot of tumor babysitting. I'm not crazy. The system is making me feel like I'm crazy, but I know that I'm not. Medicine's just really empirically bad with tumors, particularly benign tumors. They show up a little harder for cancer, although, here I am 2 years in trying to figure out if I have cancer or not, so it's not going super well. But they do show up a little bit better for cancer. Benign tumors, though, I've been digging through the medical literature, and I need to make a video on this. It's really interesting the way that there's just been this open and blatant disregard for patients who have benign tumors. It's kind of appalling, actually, to read. And it goes back to that root of what I keep saying. They are really bad with benign tumors because benign tumors are usually, not always, but usually lethal on a slower time scale than cancer. They just get slow rolled and they just get, put off and put off and put off. And next thing you know, it's not unheard of for a woman to have a surgery to remove a 100-pound tumor because her tumor was literally left to gain 10 pounds a month. I have the news clips. I've saved them. Someday I'll do a video showcasing those. So we literally will let benign tumors get to the point where they weigh over 100 pounds before we'll bother to remove them. And by that point, they're life-threatening. Like, we don't remove benign tumors when they're small and easy and not life-threatening. We kind of wait until it gets like really bad. It's kind of disturbing to see how medicine makes decisions about benign tumors. So medicine is very happy to let benign tumors take you to death's door. And that's how my grandmother died. That's how my grandfather died, right? So yeah, it's kind of an ongoing issue with medicine. So things get delayed, you get ignored, you have to get second opinions, you have to get third opinions. So that delays things by months and months. And then next thing you know, it's been over a year, and then it's been over 2 years. And I was reflecting that it's not uncommon for it to take more than a year for me to finally get imaging to locate a tumor that's bothering me. That's not uncommon. A good timeline for medicine on tumors, in my experience, is a year. If I can get from diagnosis to treatment within a year, that's actually fast for medicine. I think that's an appalling timeline. I think it should be moving a lot faster, but that seems to be about the max speed for most tumors that are not like super obvious, that are not like, disrupting your electrolytes to the point where you're already in the hospital. Like, the sicker it makes you, the faster they move. But the thing is, whether it's cancer or it's benign, both types of tumors will torpedo your ability to eat and sleep and walk and function. So they have equivalent impacts when it comes to core functions of day-to-day life, and medicine just does not understand that. I don't feel like medicine understands that. And also, it probably doesn't help that I'm not growing the 100-pound tumors. I'm really, really lucky that I'm not. But I think it's making it harder for them to take me seriously because they're not thinking like, oh, tumors can be hemorrhagic. Tumors can, like, I had a tumor that, like, you should see my spinal cord. It was like the thinnest thread. Okay, it was crushed by this spine cyst, absolutely crushed. I was worried it was going to like completely cut off my spinal cord. Medicine was not, but I was a little worried about it from looking at the images, right? So like they just wait until you are so in the weeds, right? But nothing's like 100 pounds, so it's not like super obvious in your face, and they blow me off. They forget like how damaging benign tumors can be. They believe their own minimization of benign tumors, right? So I had doctors that didn't show up, didn't really do the workups that they should have done. They did the bare minimum workups and then just sort of like quit engaging with me because they didn't want to hear it and they didn't want to do it. And these were people I worked with for like 20 years. These were specialists I had long-standing relationships with that in the past had like absolutely saved my ass on other tumors, and they just would not pick up what my body was putting down this time. So I had to switch specialists. And then I've been leapfrogging from abnormal imaging result to abnormal imaging result. We've gotten 3 different abnormalities in the same region of my abdomen that we've been following. So we find one abnormality, do the follow-up imaging. We decide that abnormality is kind of maybe stable. I personally don't think that's correct, but right now it's innocent until proven guilty. So the tumors are stable until proven unstable. But then they find something else they're worried about. So then we do a couple rounds of ultrasounds and imaging for that. And then we decide, okay, that's okay. But now we found this new abnormality. And now we're a little more concerned than we've been. And so now we have to follow that up. So I'm like on ultrasound number 6. And it's just abnormal finding from abnormal finding. And everything has an indication where you have to repeat the imaging. And it's kind of Looney Tunes. And if I have cancer, which I hope not, I would be happy to be malingering. I think malingering's great because then I'm not going to be sick. I'm just sick in the head. Like, I don't understand why anyone would think you would make this up or like over function or be over intense on it. Like, I'm just trying to make sure I don't reach the point of no return. Like, I just want to make sure we catch stuff early because stuff is happening, right? And I do feel the changes in my body pretty acutely and pretty accurately. And I feel them earlier often than medicine has an indication to act, which is very frustrating. So the first year was just me feeling that something was wrong and I knew exactly what the organ was. I didn't know it was tumors. I mean, now I know, but I didn't know it was tumors, but I knew exactly what organ there was a problem in. And I told them, I think it's this organ. And of course, they roll their eyes because all patients are idiots, right? And then finally the abnormalities, like my stomach is distorted. And so they finally order the imaging. And what do you know? I was right. Right? So that doesn't help either. So I'm feeling things really early on. Medicine is ignoring me very strenuously and resisting ordering imaging. And then even when they find abnormalities, they're more inclined to blow me off under this delusion that benign is fine. Right? Like, it's just a very complicated mess. Medicine is really bad with tumors. And in the area that we're imaging now, it's hard to image. And a lot of people end up with stage 4 cancer because it doesn't image well and it's hard to diagnose. And we may not get a diagnosis until we decide to just remove everything out of an abundance of caution. And I don't know if they're going to offer that to me. And I'm not looking forward to it because it's just not going to be a good thing. The things that are stacking up to clobber me right now are all very hormonal. They're going to like totally fuck my hormones for the rest of my life. And it's just so unfair that I think I'm going to end up with major hormonal stuff from tumors and cancer in almost every endocrine thing that I have in my body. I think the only thing untouched still is the thymus. So it just seems very unfair that I'm going to get to like have to deal with that. I'm not looking forward to it. But yeah, that's how you end up like spending 2 years just trying to figure out whether or not you have cancer. It's difficult to image to begin with. Doctors don't listen to you and they ignore you despite your 50 to 70 tumor history and your increased cancer risk. They just ignore you. They just ignore you. They fail to follow their own diagnostic algorithms and they blow you off because they have this delusion, this persistent delusion that benign is fine and we ignore benign. And that's not really what happens. That's not reality. The reality is benign can absolutely wreck your shit. And it can absolutely unalive you too. It's just slower than cancer. That's the only difference.